is well said. Biotechnology has the potential to create the value for our company and customers, and no doubt will fundamentally change the business areas of nutrition, agriculture, and especially chemicals. Namaste. My name is Karuna Singh. Welcome to the channel Knowledge Start, way to continuous lifelong learning. Today on our show, we have a very special guest, Neha Srivastava, Assistant Professor, Department of Biotechnology, IILM, Greater Noida. Welcome.
Hi, welcome. Thank you for this warm introduction.
All right. So, today we will start with the very first question that tell us something about yourself and why did you choose this field?
Okay, so as you said that I'm associated with the academics and research, and it's around 13 plus years of experience in the field of biotechnology and research sciences related with life science, medical science, and the field associated with the basically life science. So my passion is research, and I'm a hardcore academician. And currently, I am associated with the research work that is UTI based on UTI infection and antibiotic resistance. And also, I am associated as an external expert in a firm where I review the articles and give suggestions. So this is my professional background.
All right. As you have used a term that is UTI. So, what is UTI?
Yeah, actually, I have started the work on UTI in 2000 after 2016. So, because this UTI, that is urinary tract infection, it's a very common in worldwide, and the figures are very like astonishing and surprising that 150 millions of people infect with the UTI, and it's per year. It's a worldwide data. So and according to the Urology Association of official website of America, around 10 women in 25 usually infect with UTI. They are suffering with the symptoms of UTI. So this is I can say this is the oldest disease, but we are suffering with this disease till date. So when we things becomes older and older, it will be resolved. But in case of UTI, we are proceeding with the suffering, and till date, no proper treatment is available, and recurrent UTI cases are also reported. And 150 million people around the world is a very big data. So basically, UTI infection is any infection that is occurring in your urinary tract is the UTI. And basically, the urinary tract is divided into two parts. It's the upper urinary part and the lower urinary part. So your lower urinary tract consists of bladder and urethra, and this is the lower urinary tract, and upper is your kidney and ureters. So we are very prone to get infection in our lower urinary tract. So and the infection is by the microbes. The causative agent of disease is of this disease is E. coli. And the people who are associated with science and technology or research, they think that UTI is by the E. coli. Yeah, it's a very simple. The first bacteria that we study in our book is E. coli, and this is the primary causative agent of UTI. So in any part of the world. So and women's are at the greater risk of developing UTIs than the men.
So, what are the signs and symptoms of UTI?
Yeah, the basic and very common symptoms of this UTI is to urge urinate very frequently, and that doesn't go away. The burning feeling when you urinate, and sometime very cloudy urine will pass out, a bloody urine, and it's like Coca-Cola color, and a very prominent urine smell will be coming through your bathrooms, commodes. These are the basic common symptoms of the UTI. And when it goes severe, a little severe, these are the common, and this is the you can say the uncomplicated UTI symptoms. But when you feel the pain in pelvic region, then you should understand that this uncomplicated UTI is becoming the complicated one, and it is going to infect your ureters as well as the kidney. So the common and when it is going to upper urinary tract, you will feeling the pain as well as fever. So and that will be and shivering also. So these are the common symptoms of UTI.
So, how can we diagnose that?
Yeah, diagnosis can only be occurred when you analyze, when your professional doctor professionals, yeah, medical professional analyze your urine sample. They basically you see your urine sample under the microscope, and they found the white blood cell bacteria, which are the sign of infection. And doctors, when you go for routine checkup, you find that I'm suffering with the symptoms that I mentioned earlier. So you will go to your doctor, and doctor will give you medicine and medicine. But before that, he should go for urine culturing, and the urine will be cultured on the medias, the appropriate media, and the count by the pathology labs, it will be confirmed that you are suffering with the UTI infection. So the causative agents, whether it is bacteria or another microorganism, so they will be identified, and accordingly they will treat you.
What type of treatment is given to the people who are suffering from UTI?
Yeah, as I told you earlier, also there are two type of, yeah, you can simply in a simple manner UTI can be characterized as complicated and uncomplicated UTI. So first, if you have normal urinary tract, no complications in that medically, so you will be suffering if you are suffering with the uncomplicated UTI. Then 3 days or 3 to 5 days of antibiotic course will be given, but that should be after your culturing report, not before that. The problem in India or any other countries is that we take antibiotic first, and then the culturing reports will come. So doctors are also doing good, because they prescribe antibiotic on the basis of their experience. They go to the community reports, the hospital reports, the localized area report, and they know that UTI, the common UTI is by this particular organism, and it can be treated by this antibiotics. But sometime what happened, without seeing the report, we are taking the antibiotic, and that will cause antibiotic resistance. So this is the another aspect. But yes, UTI can be treated by the, if uncomplicated UTI, then it will be treated by the 3 to 5 dose of antibiotics. And if it is goes to the complicated ones, then we have to go one step ahead, intravenously antibiotics can be given. So, I must say that this should be after the culturing reports.
Yeah, all right. So is this common amongst the pregnant women?
Yes, as I told you that 10 in 25 women are infecting with UTI, and the ratio is more for pregnant women. And there are so many reasons behind it. The first is these first and the most important is that women's are carrying babies in their uterus, and the uterus is above the bladder. So the while urination, they are not able to completely flush urine out of their bladder. So the little amount is always retained in their bladder. They are not able to completely emitting their bladder. So because the reason is the same, the uterus with the developing babies sit on the top of the bladder during pregnancy. So left over urine with bacteria, and that will cause UTI. So, and this is the main reason that the pregnant women are more prone towards the UTI.
So how can they prevent themselves?
Yeah, prevention is just for if you take precautions like urinate after sexual activity. One thing I mentioned that what are the other common like reasons why the women are getting UTI, and the ratio is more than if you compare it with the men's, because through the sexual activity the germs can move and that cause UTI. And the menopause is also another reason, because after menopause loss of hormones like estrogens causes vaginal tissue to become very thin and dry, and that would be the reason that it would be easier for harmful bacteria to grow there and cause UTI. And one thing that women has shorter urethra. So the urethra is very close to anus and the vagina. So there is chances of passing of bacteria from rectal region, anus, vagina through the urinary tract. So the women are more prone for UTI. So prevention is by taking the some precautions like urinate after sexual activity. The most important thing, you should stay well hydrated. Like जितना पानी आप पिएंगे उतना आपकी जो बॉडी का टॉक्सिन है, जो बैक्टीरिया है, it will flush out from your body. So the old tradition like have water in one glass or two glass of water in the morning is very true. It will protect you from UTI. And like minimizing sprays or talcums on genital areas. And also we should teach girls or the general public the sanitization education, so they can hygiene their self. They can use and disposal of waste materials. So there should be like the points which can prevent everybody from UTI.
All right. So are there any home remedies to prevent from UTI?
Yeah, home remedies is not like you take medicine. If you follow these remedies, prevention points, like urinate after sexual activities, say stay well hydrated, and daily bath. Do not apply very harsh chemicals on your genital areas, because it will kill your friendly bacteria in that area. Use probiotics because it will probiotics will definitely your friend, because it will increase the beneficial bacteria in your system. And if obviously if the community of beneficial bacteria is high, So definitely the lower part will be flush out easily. And one thing is that there are some like cranberry juice you can take, but it should not be in very like high doses. You can take it without sugar if you are feeling that you are very prone to UTI. And recurrent UTI cases are also reported very frequently. This is a very today's scenario. This is very normal. So,
All right.
like when you're going for old ages, then this UTI will also be a problem of older women.
All right. So as we all know that during periods, there are mood swings. So do
Yeah,
UTIs affect women's emotions?
yeah, definitely. Any disease. If disease is UTI is also a disease. It's an infection. So you see that if a lady is having 3 or 4 days of antibiotic course, or very if he is feeling is suffering with complicated UTI, then intravenous antibiotic will be given, and after 15 or 20 days, recurrent UTI is also reported in women. So obviously, if you are suffering with the same problem, the problem is not the problem. It's like you are on a dead bed. You are suffering with exertion. You are suffering with the anxiety, the frustration. You are not proper. And many research is also many. If you see the papers of based on UTI, the emotional aspects of the UTI. So there are many research that reported that the person who is suffering with UTI, and especially the recurrent UTI issues, is anxiety, depression, confusion, delusion, aggression. So these are the this disease is associated with emotions also.
All right. So you have really explained UTI very well. All right. So are you currently doing any research?
Yeah, actually, I'm associated with research. It around 13 plus years of experience, but in 2016, or I started working on this UTI and the extracellular proteins that are expressing due to the antibiotic resistance. And currently, I am. This is a part of my PhD projects also. So, and research is this part is all. I'm also collaborating with this KGMU Lucknow microbiology lab under the guidance of Dr. Sheetal Verma. And I'm associated with this project, and I'm gaining lots of experience for UTI.
So why is it important for the professionals to participate in this type of activity as a member of an editorial board?
Okay, this is the important questions, because I think being a member of editorial board of this respective journal, renowned journal, and being a life science professional in research as well as in academics, it's our moral duty to generate public awareness in context of disease and their prevention. Because we do research, our motto is not our motto should not be to publish a paper. Our motto is that the finding should be shared by the general public so that they can get benefit from that. Public will be the microorganism also, the animal also, the like in animal kingdom or plants, anyone. So, as we have the better understanding toward the biological science or research, so participation in this kind of activity, where we are trying to awake awareness by simply simplifying the complex things to the general population, so that it would be easily understood by the public, so that they can live healthy and prosperous life.
Okay, what would you like to give any message to the students who are pursuing the same field?
Same field, or I can say anybody who is associated with research, uh, just do your job with full dedication, full hard work, And yeah, it's research, so the result will not come tomorrow. If you do anything, and you will so find that that we young generations, or we also, we try to find out the results in a very limited period. But it is a research, so it will take time. Give your best, analyze the things, because as you get more negative results, you are moving towards more positivity in your career. So anybody who is associated with research, it's a lifelong pathway. You every step will teach you something. So just share your knowledge. Your motto should not be up to the papers only. Guide the students, and spread awareness everywhere.
Absolutely. Giving best is the best thing ever to move ahead in the life. Thank you so much, ma'am. Thanks a lot. And thanks for this interaction. So it was really, really nice interaction with you. Thank you so much. Thanks a lot.
Thank you, dear. And thank you for calling me for this activity, as my life motto is approaching towards the goal. Thank you.
Thanks a lot. Thank you.
For more updates, subscribe to our channel, click the links shown on the screen to stay connected.